Thanks everybody for being here. Today, as everyone knows, is the State of the Department Grand Rounds. And so I'd like to introduce Dr. Leslie Walker Harding, who is the Ford Morgan Endowed Chair and Professor of the Department of Pediatrics, as well as the Associate Dean for the University of Washington. She's also the Chief Academic Officer and Senior Vice President for Seattle Children's Hospital. She's been dedicated to the health and well-being of children and adolescents for over 25 years. Her current focus is to raise awareness of and to bring to a national scale interventions to prevent the development of substance use and mental health conditions in children and adolescents, and to promote evidence-based solutions to support adolescent and childhood thriving. In this effort, she's co-chair of the Forum for Children's Wellbeing, promoting cognitive, affective, and behavioral health for children and youth in the National Academies of Sciences, Engineering, and Medicine. She's also a co-founder and executive sponsor of the UW Seattle Children's Health Equity Institute for Healthy Pregnancy, Children, and Families, and president-elect for the American Medical School Pediatric Department Chairs Council. So excited to have you here today. Welcome, Dr. Leslie Walker Harding. Thank you. I'm nervous.
Yeah. Good morning, everybody, and thank you for those of you who are here in person. It's great. I'm sure a few more people will trickle in, and thank you to all of you that are showing up virtually. I'm so glad that we have this time every year to kind of give a recap of the things we've done, the things we're proud of, the things that challenges that we are hoping to overcome. So thank you all for being here today, and hopefully those of you that are here get some snacks and coffee, and we can continue to work on having more and more people come in person. So as usual, let's just start out with the land acknowledgement, which is important to continue to elevate. UW Pediatrics recognizes the traditional and unceded lands of the many indigenous communities and tribes in our facilities occupy across Washington, Alaska, Montana, and Idaho regions. UW Pediatrics honors with deep gratitude the land itself and the people and tribes past and present who have called the land home. But always remember, this acknowledgement does not take the place of authentic relationships with indigenous communities, but serves as one way to honor the land we are on in this region. And again, a tradition I think that's important to continue, especially in times of uncertainty and recovery. It's important to continue to remember why we are here and our mission and vision. Through excellence, innovation, and collaboration, we will improve the health of all children and adolescents and reduce inequities by educating the pediatric and physician leaders of the future, advancing research, advocating for children, and providing the nation's best primary and specialty pediatric clinical care. In partnership with our healthcare and academic institutions, we are committed to a diverse and inclusive department in which faculty, staff, and trainees can each reach their personal and professional goals in a collegial environment. I do want to say that in our department, diversity, anti-racism, inclusion, and equity are good words, not bad words, and we will continue to use them and hold them up high. And in terms of our vision, we still strive and continue to want to be a vibrant Department of Pediatrics, so we have unified, collaborative efforts that produce and continue to bring a vibrancy to our department in many ways, between diversity, energy, enthusiasm, mission goals, and just joy in being able to have the privilege of doing something that you want to do to help people during this time. So I have a little bit of a, I guess I would call it a preamble that I wanted to start with, considering all the different transitions and the really crossroads we're at now that I wanted to impart before we get started. I think it is great today to have a chance to look over all the accomplishments of the department over the last year and get to preview some of the goals that we have for the upcoming year. As we continue to reset from the effects of the pandemic, and as we take a proactive stance in positioning the department to continue to be a leader in transformative change, not just reacting to the forces outside of our control. The department has continued to flourish and achieve amazing advances for children and adolescents. Many of us, though, are viewing 2025 with much trepidation and anxiety at all the possible changes that seem to loom ahead and threaten to make it more difficult to achieve our missions and in research, clinical, educational, and community, and even career satisfaction. While I don't have a crystal ball on what will or will not happen, I do have complete confidence that we will successfully weather whatever may come. We have been here for decades. We have had many threats to many different things, from clinical service, how we get reimbursed, from attacks on and cultural wars and attacks on our NIH funding, from direct attacks on efforts for anti-racism, diversity, and inclusion. We have lived through these things, and we've continued to thrive and continued to move forward. And at the same time, we have many national experts that are in our department and every aspect of all of the possible spaces that we could possibly see change. And they're not advocating just for our department, but for the whole country. We're very fortunate in having such amazing people, working nationally for us and for everyone else. And we have tremendous faculty, staff, and trainees with innovative ideas and a clear focus on why we're here. We will be fine. We'll thrive. We'll be okay. It's my hope, though, that we not only will just be fine, but really will be able to help move the whole needle forward for the country and what academic medicine should be at its best, and really moving forward and being able to quantify how we are improving the health and well-being and the health status of children and adolescents and families in this country. I know we can do that work. I see us doing it, and nothing we're doing now that the country can do now will stop our goal. So I just want to give that plug as people worry. We're going to be fine. So. And as I begin the talk, as usual, we had, and it was amazing this time, we had every single division give input on what they've done and how, the things they're challenged with, the goals they're having. And with that, each one of them, I could spend 45 minutes to an hour on each division. We have 22 divisions. So, I will, again, just be giving you a snapshot of everything that people are doing. And not all that people are doing, because we don't have space for that. But one of the things, again, we were trying to get on the task of having a space where we can put all of the years of the submissions together in one space where everybody can look and see what research is going on in different divisions. We're in the final stages of recruiting a marketing and communications person, so hopefully over this next year we'll figure out how to do that in a way so people can access it, at least within the department, if not further, so that you really get a full breadth of the work and the amazing dedication people have. So for new people that are here, I just want to make sure you know who our executive committee is and what it's made of. It's made up of the vice chairs and the chair. This year, the newest vice chair is Dr. Abena Knight, who is now our vice chair of education. And I hope that you have seen the other faces, as they have been doing a great work to help lead us in our vision and mission. And likewise, in strategic operations and finance, we have a wonderful team that stands with us, beside us, and helps move us forward in so many different ways. The new person from last year is Neil McLeod, who's our amazing manager of facilities. He brings a lot of experience in that role and has already been so helpful for us. And as I mentioned, we are at the end stages of selecting our new manager for marketing and communications. I have already warned all the finalists that everybody wants their website fixed. So to take it slow, because it's a big job. It's probably going to take several months, if not more than a year or so, to get that in the order that I think we should have it, and everybody else thinks. But all of the finalists are on alert about that. And then in the department, other leadership changes. As I mentioned, Dr. Knight is our Vice Chair of Education. Boots, Dr. Matthew Kronman is our Associate Vice Chair of Education, which he was named. That's a new role in July of 2024. And our own Elaine Albert is our Pediatrician-in-Chief that works with Seattle Children's and the department to really move some initiatives forward in very definitive ways. And they're all already at work doing amazing things. And we had 2 national searches. Both were very competitive. And Dr. Taylor Sawyer was named our neonatology and perinatology division head, and Dr. Daryl Okamura was named the division head in nephrology and took over just this fall. So please give them some encouragement as they walk into these positions with some very important, influential, and relatively large divisions. So thank you to both of them. And I mentioned Neil, and we are extraordinarily happy to have Dr. Alyssa Darden here as our residency program director. She began with the latest cohort of residents in June, and Dr. Erica Hallhusen is associate clerkship director, and I believe in hospital medicine, and she's really helping with the inpatient course. So those are some of the role changes and additions this year. And looking at just our statistics, we've grown, each year we grow a bit, both in CUMG and PhD faculty and affiliate. It's always funny to, it depends on the day what the total number is. It's a hard, when I first started this job, I couldn't figure out why we couldn't just definitively say how many people we have. But there's so much kind of floating and transition, who's faculty, who's, so this is our best numbers. They continue to increase. And I expect over the next 7 years, as we work toward Renton campus, which will be a bigger campus than this, we will continue to grow in many ways. And we had 106 appointments. That's a lot of work for our faculty affairs group, and new faculty this past year. We had a little bit of an increase in our advanced practice providers. And as I mentioned, we've had these successful searches and ongoing right now, in addition to the communications manager at Seattle Children's Research Institute. We are nearing the end of our search for a CCTR division head. We are just beginning solidly within the CHBD center director, and CIGDR will begin early in 2025. It's kind of a time of change because the centers have been around now for maybe 17 years. So this is a natural time of change and renewal of the center directors. We expect there probably will be a couple more in the next several years as well. In terms of finance, it was really wonderful that we were able to meet our goals that we had last year. They were incremental goals. Each year we need to kind of step it up a little bit more so that ultimately we are able to fully support ourselves on our revenue. That'll dramatically change how we hire and the decisions we make with our funding. And so, we went up a little bit. We have faculty and trainee compensation increases, which kind of account for the 10% increase in our what we need to run our department, which is about $243 million annually. But we look forward to continuing to do well. I think we've started out well already with this year. In particular, the most momentous thing that happened in finance is we were able to come up with a PSA agreement with Seattle Children's that really allows us to stretch, but also to realize our achievements when we do well. That took quite a bit of time and a lot of work, but we came to, with the finance committee, with Aaron, Aaron Allen, we came to an agreement that we all feel really good about, that we can achieve and also stretch and really help our department to thrive financially so we can get the things done that we would like to get done. And in terms of research funding, we again had an increase over the last year, probably most within SCRI with an increase in $8 million from last year. And both Fred Hutch and UW research cut increased $1 million to $2 million. I know people are very nervous about all of the spoken wishes of people in Congress to change NIH and have NIH reform. Sitting on some committees nationally where we are advocating pretty strongly for what we think should be some of the changes, I do think there will be NIH reform. They're very much, both sides of the aisle are very much interested in looking at that. They haven't looked at it in, I think, almost 20 years or more. I can't remember. It's been many, many years. So it's on the radar. How that happens, I think we do have some influence nationally with all of our organizations are working together on that, as well as individually. I think we can continue to make our voices heard with our senators and people that we can advocate for why research is important. But that will be something that we'll be working with. And again, I still think we'll be okay. We've been here before, and having to worry about what's going to happen to certain funding, especially when there are cultural wars. But we can continue to work together and continue to make our voices heard. And I do think it will make a difference. In terms of our department committees, again, if you are new to the department or you weren't aware, I just wanted to make sure everyone is aware of some of our initiatives and committees that we have. Climate Change Care Committee presented in the last year, as well as, I think, Global Health, the Global Health Collaborative. I'll talk a little bit more about the JEDI Committee in a minute. The Environmental Health Initiative, I haven't really talked about so much, but I really want to see us have a very clear and defined footprint on clinical environmental health as well as research. And so we are working hard on that. The early coaching program has been a success thus far. We're very excited about all the people that volunteered to become trained to be coaches, as well as PEDS Talk is going well. Brim PEDS I'll talk about in a minute, as well as our revamp of our early career development program, which is now called the PEDS program. And before I get started on some of the priorities, I did want to take a moment. Like last year, I really wanted to highlight emergency medicine and the work they were doing on the front lines. This year, I think we need to really take note and elevate and stand up the work that adolescent medicine is doing. They are on the forefront nationally and locally, really trying to bring kids the care they need in gender-affirming care. They've been personally and as a group attacked for this work. And that doesn't end. It probably will not end next year. And they have stood really strong in that. It's been very hard and very personal, to have people personally attack you, to have people attack these children and their families, to have people from all over the country call and ask if they can come here to be seen. And, there's a lot of complexities with who we can see and who we can't see. And they've been navigating this for more than a year, but it's really gotten pretty heated in the last year. And I just want to hold them up and, for people to think about the work they're doing every day to help our kids with a lot of personal capital put into it. So I do want to congratulate and thank Adolescent Medicine for their work, and you're appreciated. So. And so let's move to some of the department priorities. And this is, the department as a whole, looking at where we were, what we've been looking to address. They haven't really changed. We're still doubling down on trying to be financially sustainable. We're still looking at operational effectiveness, and I think that sometimes can be a bad word. Efficiency means more work, more hours, faster, being more overburdened. But that's not what we mean. I really don't think we need to work harder. I think we need to work better. We need to work with the hospital, and we are, to have better systems for how we do some of the administrative work and the kind of people that are helping us to be efficient and see the patients that we need to see, and hone in on the areas that only we can do and the areas we need to help the community to be better at doing, so that we have good flow and not year-long or longer wait lists for some of our specialists. So I think that's good work. I know even within CUMG and Jack Salerno as our Vice Chair of Clinical Services, as well as working with CUMG and a number of people in different divisions have gone through value stream work, working directly with the hospital on how to make realign what is important, make some of the work easier, look and see what kind of people are needed to make that work go well. So this is going to take some time, but it's important for us as a department, and it's important for the people who depend on us for care. And retention and recruitment is continuing to be very important, and how we do that is going to be the difference between us being able to retain people in such a high-cost area. And undergirding all of that is still our dedication to equity, diversity, inclusion, anti-racism, and just belonging, community identity. We've been working pretty hard to try to have a lot of different spaces for people to step into, so that they can have, hopefully, better balance, understanding of that they're here within our department and we support you. So that work is continued and is wrapped into all of our objectives. And so in this vein, the next few slides will be the vice chairs, each of their areas, as well as their the rest of the team and the vice chair team have put together some of the areas that they've achieved, some of the priorities for next year. So I will bring those up. The first one is the vice chair of DEI, Dr. Jason Dean, who has partnered with Maria Zontine and Julie Avenar. And some of the big achievements, for sure, is having Terry Laguna be selected and accepted being the JEDI community chair. We already have merch from JEDI. I don't know if you've seen it yet, but there's actually a JEDI pin now. It's awesome. So there's a lot of excitement and work within that committee. In particular, one of the surveys that we just finished, the climate survey, they'll be looking at that work along with Jason to see where, what are the trends over the years. We've done the climate survey, and where do we need to do some further work, and what's achievable, what can we do in the next several years. We usually do this survey about every 2 to 3 years, and so in that time, what can we do to make a difference? So that as they figure that out, that will be presented to the faculty. And continuing to really make sure that our recruitment pools are diverse. Some divisions and some specialties, it is difficult, but it's not impossible. So, I'm really grateful for everybody's efforts to continue to try to recruit the best people here within the best pool that we can possibly have. Let's see, in terms of advocacy, and there's been, with the additional funds we have for people who want to go to their affinity conference, we've had a number of people go to different conferences and really begin to see that broader support network they have within whatever they have identified as their affinity space. And so that's been great. And one of the big things with the center, our new center that Jason Dean leads, the UW Medicine Center for Indigenous Health, we will have a visiting professor. They have a new named professorship, and Dr. Allison Impey will be soon in January coming to give that, and also speak to a number of different groups within the department and outside of the department while she's here. And then BRIM Peds Plus, which means bias reduction in medicine for pediatrics, because it was developed by 4 women for internal medicine and validated. And so it's BRIM Peds Plus. The plus is anti-racism, because bias and anti-racism are 2 different things. So the amazing work the team has done, led by Theda Ong, Hannibal Person, and Roberto Montenegro, who's a psychiatry faculty. That work has really blossomed into something quite wonderful. So far, 5 divisions have been trained in this curriculum. One of the things that's a bit different about the curriculum, for those of you who haven't done it yet, is that it uses examples within your division of, rather than just kind of global, let's do something good. It's like, okay, let's see where we have been. What are some examples within our field and in our division in particular that we can use to really ground the importance and the goals of what we're doing? So we've had 5. I'm continuing to fund that. That's directly out of department funds to develop this and have it be administered. And the cool part, they were able to get it have 2 credits for American Board of Pediatrics maintenance of certification, so that's great. And so that should be coming to every division. It will take some time because you see it's 3 2-hour workshops over a 6-week period. So it has to be scheduled appropriately so we can have maximum participation. But it's really quite elegant. And one of the things that I really asked to happen was that we do it in a way that we can then report it. We can measure it, report it, look at the outcomes, and that's what's happening. And so it's quite wonderful. And I really thank the leaders that have moved it forward. And here's just a picture. I wanted to highlight one of the conferences that I don't know that we really attended in any large way in the past, but Dr. Terry Laguna really led that initiative. And then this year, so she brought some people the first year. This year, she also got gastroenterology and hematology division heads to go with her, and there was a much bigger group that went. And people talk quite a bit who've been there about the amazing knowledge that they receive there, as well as the support and acknowledgement of, they're not alone, in some of the challenges you have as a woman in academic medicine. And likewise, we have a group led with Jason Dean, who goes to the Association of American Indian Physicians. What's really a little bit different about this is that there are many residents and students and pre-meds there, and our presence is really great because when they start thinking about where they want to go, they can remember all the people they met from the University of Washington, and that will help us with, letting people know that we are a welcoming place and we want to see more people come. And so now I'll switch over to the residency program. And these are some pictures from this year that I think actually are good pictures to show. One, I can bring it up now. It's the 10-year the 10-year anniversary of the Alaska track. Is this year. It's pretty awesome. And looking back at the research, 75% of the people that have gone there have stayed in somewhere in the region. And that was the goal, to have more people stay in Alaska and similar regions, and that's what's happening. 75%, that's pretty awesome. Doing a lot of work to get our faculty and everybody back to morning report, and the physician executives, formerly called chief residents, if you're new, the physician executives have started some initiatives that really probably are helpful with well-being and fitness. And the interns have their academic half-days. So in education, as I mentioned earlier, Dr. Abinanite is the vice chair, along with Boots as associate vice chair, and Carrie Dietrich. They kind of work together as a trio to lead and think about what we need to do. And then in terms of, I mentioned the Alaska track. In terms of medical students, it's a continual challenge to find places, because all of the medical students at UW need to have pediatric exposure, which means it falls on us to look and see where we can do that all over the WWAMI region. And it becomes difficult sometimes, especially with WSU, also looking for pediatric clerkships. So the work and the relationships that our team has generated over the years has really paid off in us being able to even increase a bit of those spaces where students can learn. So that's been real important. And then again, looking forward, trying to continue to increase those opportunities for preclinical medical students, in particular, electives. Not all of our specialties have electives, but trying to increase some of that, I think, will help us with the national crisis and workforce, and having people be able to have exposure to different specialties where they might not see that on an inpatient basis. It's important for us to think about that and help with medical students as well as residents in that vein. And the Fellows College has been doing a lot in terms of helping people come back in person. They're piloting a new SIPS and Science session for second-year fellows. Hopefully that'll draw them in. And the power of having a cohort to work with is priceless, and so hopefully we can bring some of those back, as well as their lunch bunch. And advocacy, working across the university with the School of Medicine Black Health Justice Pathway. We've collaborated with them in their advocacy and community partnership elective, and reestablishing the resident advocacy committee has been important, as well as in the fellowship working to bring QI safety training to all the subspecialty fellows. So there's been a lot of work going on with our education. In terms of hot off the press fellowship match that just happened, we actually did better than we did last year. It is a very, very competitive, I don't even know if that's even the right word. We have specialties like nephrology where only, I think it was 27 or 29 people in the country wanted to go in there, and there's 64 open spots. We're experiencing that with a number of areas, but we had more filled than last year, and like with nephrology, some of these are going to probably fill outside of the match, have at least one or so. But it just again underscores the national stress we're having, and the work that Fred Bravara helped chair at the National Academy, looking at the workforce initiative. Many organizations like AMSPDEC, where I'm going to be chairing that, president of that, beginning next year, we're all focusing very closely on how we address the workforce crisis that we have within pediatrics in particular, and within pediatric research as well as specialists. So that's some ongoing work that we're going to have to work all very hard. But with that, our reputation and our ability to still fill these fellowships is quite amazing, because this is not the way many places look. We're very fortunate. So I thank everybody for their efforts. Let's flip to faculty development and well-being, where Dr. Richard Sugarman and Maria Zontine pair together to help continue to work on the many offerings we have begun to have. The main one that we're launching, and we hope everybody is supportive of and signs up for, is the Pediatric Early Career Development Support PEDS program for our early career faculty across from research, clinical scholar, all groups have a space in this program, and we encourage all of our faculty within their first 3 years to complete the program. It's been done really well, and I've heard that each session has 3 times that you could come to it. And I've heard that all 3 of the times in January do have number of people signed up, so I'm really glad. So to make sure that if you're over at downtown at SCRI, you can go there. One of the sessions, 2 of them are here. And the hope is that at the end of 3 years, you have gone through all of the sessions and you have participated in some of the other more face-to-face networking, mentoring activities. And the other thing that I think has been wonderful, all of it's wonderful, but in particular, the division head surveys and 360 evals with coaching. We're in our 4th year, and it's really been very noticeable how amazing it's been for our faculty and people to give feedback on the leadership, and how amazing it's been to watch our leaders take that feedback, good and bad. It's nice to know what you're doing well. It's nice to know where you might want to improve. And being able to have people have these evals has been really transformative for a number of people. And so we're happy that that's continuing to be led by the faculty development group. And we soon should be analyzing and sharing the results of the well-being survey that was run out of this, the faculty development unit. Research, a lot is going on. I just yesterday got the preview of the summary of the listening tour that Dr. Luke Hoffman, as vice chair, has led with Doctors Margaret Rosenfeld and Stefan Kappe, as well as Patrick Lennon, to really get an assessment of what's going on. And we won't do it again. until we can definitively say we've made some changes and we want to see what you think of the changes. So we're going to, I don't like, when you keep asking people over and over, but you haven't changed anything and you come back every few years, people get tired of that. So we're going to make some changes and then we're going to come back and see what people think of the changes. But that information is going to be presented to the faculty as well as they package it for that. And as I mentioned earlier, Dr. Margaret Rosenfeld will be stepping down as Associate Vice Chair at the end of 2024. She was the inaugural person for that new position, and she did an incredible amount of work, and she has an incredible energy and dedication, and so we will miss her, but it's really wonderful that she helped carve out what that means to be the Vice Chair of the Associate Vice Chair of Clinical Research for the department. Clinical Affairs have been working on a lot of areas as well with Dr. Jack Salerno as vice chairs and Dr. Christina Tancre and Dr. Taylor Sawyer as our associate vice chairs, along with Tim Appel and Travis Ewing. One of the big things, the two big things I think that are going to prove to be very helpful is the e-consults and the e-consent that now we can have directly the patients sign in their medical record. Those are two accomplishments, and there's a lot of work both on the university side and on Seattle Children's side simultaneously looking at effort. In particular, Children's is looking at clinical effort, UW is looking at effort altogether. And we have people in both of those spaces working together and making sure that there's some coordination with that. But very hard to tackle, and both are tackling it at the same time. But I think we're in a good position to have some improvements. Academic Affairs Vice Chair is led by Dr. Fred Rivara with Dr. Arlene Klein as the Associate Vice Chair, and Christina Woodruff make up the trio there. And one of the big things that's taken a lot of work is integrating the new clinical practice track into the Department of Pediatrics, coming up with what we think should be criteria, promotion guidelines, getting that approved by the provost office and going back, having the department approve it, and now implementing. So this is actually, it's going to be great to have this pathway, but it's been a lot of work to get it to the point where we actually can execute. And so we should be bringing on people in the next year onto that pathway and having people understand with Dr. Rivara and others going to different divisions to explain what this means and, should you switch to that or not. Some of that will begin in this next year. And now we come to the department and division highlights, which, like I said, I'm always a little nervous about because there's so much and I have to pick just a few things. But one thing that I didn't have to worry or think about picking was the fact that Dr. Bott is now the Senate Vice Chair, Faculty Senate Vice Chair, and will be the chair of the Faculty Senate coming up 25-26 year. It's the first time, we believe, that a pediatrician faculty member has been the president of the University Faculty Senate, so it's pretty exciting, and we really hope to support her. And then we do have quite a number of people who are on the Faculty Senate. The ones with the asterisks are in their second term. I think if you're interested in being a part of the Faculty Senate, it would be great to reach out to any one of these people and talk to them, so that the people in the second term, as they rotate off, we have other people who are interested and want to participate. I think there's a lot of very consequential things that they decide, like the clinical practice track or changes in the faculty code that they really have a real strong voice in. So it's important to, I think, continue to think about if you want to be a part of that. I think we had, again, a record number of people elected to the American Pediatric Society. This year we had 10 people. I'm not sure if anybody had more than that this last year from any other institution. And so we'll be honoring them during the PAS conference at the Howland Award Dinner. That's where they get formally recognized, being entered into APS. So congratulations to all of our faculty. It is a process. It's not automatic, so it's quite an honor. And here's just a little picture from last year with, they're not all our faculty, but they came and stood in the picture, so. So they're our friends, I guess. And then SPR, Society for Pediatric Research. Again, you have to be admitted into this, and we had 3 amazing researchers who were admitted into SPR this year. If you think that you should be a part of SPR, it's very good place to have leadership, again, to work on national leadership. It's a place where you, get to work with people who are focusing on pediatric research specifically. I would reach out and talk to them, talk to others who have been in SPR, and make sure your division head knows you're interested in participating. And as usual, there are always amazing people that have decided to move to different goals and retire from their work in our department. And so we had a number of people who have really been foundational and really important to our department retired this past year. And so I just wanted to make sure, if you didn't know or hadn't heard, that they did transition to do other things. And again, every year we have a number of people. You can't see it. It's just to show you the number of people that have been recognized by the community as top doctors in the Seattle Magazine, as well as Seattle Metropolitan Magazine. Many people have been recognized for year after year after year after year. So at some point, I'll try to look at that and highlight those people. But it's quite an honor to have the community recognize the work you do. So thank you. Now, looking at national impact, this is where many of the division heads gave areas that they thought were really important in that area. And I just want to make sure you have seen some of these. The one I would highlight is developmental medicine, because that across the country is really difficult to fill their fellowship spots. It's really difficult to even have a full complement of development behavioral faculty in academic medicine, and across the country it's the #1 area, along with child abuse, that people are always looking to have and find. Their group has filled their 2 spots for fellows over the past 4 years. That's incredible. The work that Dan Doherty and his team are doing has been quite remarkable that they're able to do that. And I hope that they'll continue to be able to do so. It helps us with recruitment as well for faculty. And craniofacial still all in the world. Improving kids' lives, and Genti Bio, B Biopharma, and IP. The IP disclosures are pretty amazing. That are coming out of there. Again, transformative in help changing how we do health. There's a number of things here. In particular, I also will bring up hematology oncology, because this just happened, I believe, last Saturday, where Dr. Rao and Dr. Lowe presented at, is it ACR? American Cancer. There's an R. I don't remember the other part. But their main conference, they just presented this groundbreaking work that changes the whole standard for how ALL is now treated. They made some discoveries on a medication that can improve the outcomes significantly. And so people are already changing their standard of care based on this research. And it was published as well on Saturday at the New England Journal of Medicine. So it's quite amazing that the leadership of that came out of our department and division of hematology oncology. Again, there's many other people who are leading and different national organizations being admitted. The one I will bring up, just because it's quite extraordinary, that we had both Tamani Coker and Ali Rohani Rabar inducted to the National Academy of Sciences, Engineering, and Medicine in the same year. That's really quite amazing that we had 2 people from our organization. And I thought I saw, yes, there she is. Tamani's right here. So congratulations. That's So, I think we're well represented around the country for the work that people are doing. And that's why I say we're in positions all across in many different areas to help address whatever changes are coming our way in a national as well as local way. And in local impact, there's many, I think I have 3 slides of things. I couldn't pull it down because I just wanted to make sure you could look at this. And later on, if you want to come back and look at the slides, I think that would be great. I'm interested to find out about this bloodless cardiac surgery program. That sounds pretty exciting that we have a grant for that. The recruitments have been quite massive. Like in cardiology, they have 11 new people that they're integrating into the group. Oncology recruited 14 new people integrating into the group. So quite successful recruitments of needed areas that we needed. Dr. Baresh in emergency medicine has been acknowledged in the media as well for the work he's been doing in our emergency room around treating people with opioid use disorder right there in the emergency room. We'll talk about that more later. But there are many things people are doing that I think are worthy of bringing up and thinking about. Let me see here. Yeah. Here's some others that from other divisions. I think I tried to get most of the divisions in here, but the amount of work people are doing in the community around, like with the Northwest Conference on Childhood Grief, the Mighty Are the Women. The pulmonary received a award to further delve into well-being. They received a UW grant to help with that work. And one thing I will bring up here I think is really great because it's foundational, that can last, will outlast all of us, is the Pediatric Medical Operations Coordination Centers, bringing together critical care, help to bring together all of these different groups within the area to really have a strong pediatric disaster surge management. I think that's some wonderful work that will outlive all of us. Let's see. Yeah, hospital medicine's been making a lot of changes that have really helped, and they've been really good about the work that we have to do to accommodate the changes for residency training that's going to impact a number of our groups like oncology, hospital medicine, neonatology, in very palpable ways, and it will impact the faculty and service. And I do want to say thank you to people for engaging in that work and figuring out a way to do it because, again, working with the chairs across the country, this is something that a lot of people are resisting. It's going to be hard, and people were not resisting it here. I mean, it is hard, and it has its challenges and the changes, but the people have recognized that it's important and have worked toward it, which is wonderful. And then awards, I will highlight a couple of these. There are many, but I think Dr. Bonnie Ramsey's award deserves its own recognition. She is the first person from our department to receive the American Pediatric Society John Howland Award. That's arguably the most prestigious and highest award you can get in pediatrics. For her significant contributions to advancing child health, specifically around cystic fibrosis, as well as her continued mentorship and pushing for innovation in the field. She will be honored at the Howland Award dinner at PAS next year, which is cool. It's in Hawaii, and that's hers. But we will all be there. Hopefully, we'll have 2 tables. Of people to be there and support her in her recognition this past year. The other one I think that bears mention as well, since it's the first time pediatric program has won this award, is the Truman Katz Center for Pediatric Bioethics and Palliative Care received the Cornerstone Award from the American Society of Bioethics and Humanities. Again, a collective effort that was recognized, and so it's pretty exciting. And I just had some pictures of Tony. In the AAP this year, he received 2 awards, one Lifetime Achievement for Transport Medicine. The other one was a Pediatrics Section on Emergency Medicine Award, the Jim Seidel Distinguished Service Award. So he had 2 honors at the AAP meeting, which was quite wonderful to see his recognition. And then there's some that I just put that I saw in the notes that I tried to kind of pull up that are more local. Lots of mentoring awards that people have received. Molly Groh was awarded the Husky Sustainability Award for work in Pediatricians for Climate Action. And that was pretty exciting. We had Eric Chow be the person to have the Jennifer Lynn Krantz Unravel Pediatric Endowed Chair from Fred Hutch. So there are a number of things going on, and these were some that I saw listed. In addition, Yolanda received the School of Medicine Excellence in Mentoring Women Faculty Early to Mid-Career Award, which is also amazing. These are very competitive awards, so it's great to see her recognized for her work she's done. And then just looking at innovations, notable achievements, there are so many. I just put one slide. Because, I could continue. I could have had 50 slides. But one thing I do want to highlight is Dr. Tandon's new book, Digging into Nature, Outdoor Adventures for Healthier and Happier Kids, sponsored or probably produced by AAP. She was at the AAP meeting signing books and stuff, and so that was kind of cool that she's, clearly that's some extra work outside of day-to-day work. But there have been many acknowledgments that I think we could go through. The moral distress rounds, which as an adolescent medicine person sounds quite terrible, but but I think that sounds really, they're doing that work in cardiac critical care, really to educate, I guess, and have a lot of team support for some of the hard work that they do and being able to have the resilience to continue that work. But, there are many things here. I'm giving a little pause just so you can read down some of them. Community involvement. People are really taking advantage of the power we have as pediatricians using our voice in many different spaces one, like the Duncan seminar, ableism seminar that Development helps run, all of the camps that we do, people working at the food bank, YMCA food bank, the cystic fibrosis, sickle cell disease walks, so many things people are doing outside, really embracing the knowledge that as pediatricians we have a voice in the community. So I think that's wonderful to highlight. And this was a climate symposium that was held last year for the university. Pediatrics really stood out very prominently in this work, and so we had a few pictures just showing our attendance there. In terms of transitions, Dr. Jason Debley not only is the new center director for our new Center for Respiratory Biology and Therapeutics, he also helped, along with Nicole Hamblett and others, really craft this new center to really, in the past, as you know, with the SCRI, centers aren't created over, a lot. And there was a good argument for really pulling all of the respiratory biology work, being able to have a way that they could have lab space out of the translational center, CCTR, and into their own center. And what this will do is bring other people in that didn't see that they had a home with, they do respiratory biology research and didn't have a way to have a lab in CCTR, so they found a home somewhere else. This has really been quite important to pull this together, and he's leading that. We've had some amazing recruitments that are continuing to expand our ability to do work both in diabetes research, in adolescent pediatric gynecology, and let's see. Yeah, Brian Johnston is now the Associate Medical Director of Harborview Medical Center, for those who didn't know that, which has allowed Heather Hinney to take on the Gen Peds leadership role as Associate Division Head for Clinical Affairs. And the other one I wanted to bring up was Dr. Rulamini, and I do it slow, then I can't say, Rulamini, who is took on the inaugural position at the School of Medicine, being the Assistant dean for faculty recruitment. That's a new position. She's taken it on, and she's going to make it happen and make it real. We do, again, just real quickly, wanted to make sure you remembered to thank Dr. Rosenfeld and Sawyer for the work they did with their inaugural positions, really making both of these associate vice chair roles real, and we will be looking in the early next year to have other faculty step into those roles. We might be changing a bit the Dr. Sawyer's role. We do need another associate vice chair in clinical services, but we will be revamping that one a little bit. Lots of strategic initiatives. I'm not even going to go through all of them, but everybody had things that they were working on, which was really wonderful. And then advocacy, I have up at the top here some of the residents. The residents have done an amazing work in continuing to be advocates in our state, and from testifying to working with the AAP, working in the Seattle community. So I just wanted to make sure we highlighted that. And again, with Chris, I think this was just an amazing story that Dr. Woodward shared with us on some of the work. When you do work in substance use, you see people who get frustrated because, like, he had a kid who came and overdosed multiple times. Each time you have to bring them back. Each time you talk to them. Each time you talk. Well, you never know when that's going to change somebody's life. They're alive to have the change, right? And so this young man that he had been working with is now in college, studying to be a substance use counselor and work with other kids who are struggling the same way. If Chris had gotten tired of working with him, he may not even be here in this world to do this work. So it's really wonderful to see the work that he's been doing and really moving forward a children's hospital in this space. And then the last thing that I will highlight, just to make sure people are aware, I think this is a lot of hard work, to have Seek First, have a clinical workflow that can increase equity access to having genetic diagnosis in the NICU. That was adopted this year in the NICU, so now people have that access to genetic diagnosis when they're in the NICU in a way that they never had before. So I think that's pretty exciting. And I think we talked about most of the others. I just had some pictures, trying to remember, having us all remember that we are all part of friends and family, and it's wonderful to be able to come to the pediatric celebration and people are able to share their family and supports behind them. But I really love our department. I think it's just quite fun and amazing, and through the stresses and trials and all of the things that we do, it's wonderful to work with everybody here and do that work together. So that's it. Thank you.
Thank you so much. You, again, perfect, with 1 minute to spare. And we do have one question from the online community. Okay. So I'm going to take that opportunity to ask from Dr. Sunny Jewell, can you give an update on the Renton Center?
Yes, it will be, the goal is, I'm on the committee to help with that, really looking at the educational needs. It will be, the goal is to have it finished in 7 years, not 10. So they're moving really fast. We just had our first meeting this week to look at how we can, it doesn't sound fast, but it takes forever to build a building. So 7 years. And it will be a campus, right? It'll be a bigger campus than this. So deciding what's going to be in both, is ongoing work. But we'll have 2 campuses.
Wow. Amazing.
So, yeah.
Thank you again, Dr. Walker Harding, for all of your advocacy, hard work for our department. And thank you, everyone, for being here. And we will be here again next week, so please come back for Grand Rounds next week. Thanks so much.